participant aged 30 to 39 stated, "I became suicidal. Starting HRT saved my life." And that, I think, speaks to a woman anywhere in the lifespan, if she is not having maximized hormones, that greatly affects the mood and quality of life. My inspiration.
Hi, we're the American Menopause Company, and this is Dr. Lisa Robinson, and I'm Brianna Guan, Dr. Brianna Guan, and we're back for another episode. Our company is the American Menopause Company, and we co-founded this company to help support and empower women in menopause. And today we're going to be reviewing an article on premature ovarian insufficiency. And I can just introduce that article. So, the article was a survey done on women who have experienced premature ovarian insufficiency. So, they did that across English speaking nations, so England, Australia, United States, and gave out a survey to capture data about the women's timelines and then also what they experienced medically and personally through their experience with this condition. So, Doc, do you want to share with folks about premature ovarian insufficiency?
Yes, so that the definition of that would be decreased estrogen levels. So patients would have symptoms of essentially of menopause where they're feeling super emotional, tired all the time, possibly, well, an interruption in their cycles, or their cycles are different than how they had been or infrequent. And so the diagnosis of that is via blood work, and that would be FSH and estradiol would quickly determine if the patient has primary adrenal or a estrogen insufficiency. So it's not, however, the article was explaining that patients from the time of their symptoms, even if they were 25, so the women were 25 to 56, even with the symptoms, it took 4 years on average for the patient to be diagnosed. So I think that says that women are often not taken seriously. Their symptoms, they're just dismissed, or like, you're feeling fine. Really, really, we get a lot. Patients tell me, well, you're feeling just fine. Well, no, they're not feeling fine. And so you could even ask for simple blood tests, that FSH and estradiol, in determining what the hormones look like. And then if that's abnormal, then the clinician can say, oh, okay, so now we need to do a more thorough workup and figure out the cause, etc.
Hmm. Hmm. Yeah, I'm not surprised, but it is shocking and heartbreaking to hear that
It
women
is.
go through these symptoms and mysteries in their bodies for more than 4 years before someone gives them an adequate diagnosis. It's heartbreaking, really.
It is.
So premature ovarian insufficiency is diagnosed if your ovaries stop functioning before the age of 40.
Yes, correct.
And that can start in adolescence. So a woman could be in her teens or 20s and experience this change, or her 30s. And the younger that it happens, the more of her lifespan that she's impacted by it. So the article brought out that women who go through it earlier, they have a whole life, or can have a majority of their life experiencing this first. And so they have a very different experience of it versus women who go through it later, but still it's impactful physically and emotionally.
Yes, I rarely want to give quotes, but I want a couple of really stood out because this is a survey.
Mhm.
So the first one, a participant aged 30 to 39 stated, "I became suicidal. Starting HRT saved my life." And that, I think, speaks to a woman anywhere in the lifespan, if she is not having maximized hormones, that greatly affects the mood and quality of life. And so, what we do together every day to help patients is so important. The other portion in the survey, they had this section called existential rupture. And the quote from the article is that women described a fundamental disruption to meaning, identity, and belonging. The intensity of this rupture was shaped by cultural narratives, healthcare interactions, and timing of onset. And again, I think that speaks so well to how women are often dismissed and how important what we do in treating hormones and helping with hormones, just how important that is. I like how you pointed out, we were talking earlier about patients who'd had hysterectomy, because that obviously equates with ovarian insufficiency very abruptly. And I would like for you to talk more about what you see in terms of patients being taken seriously post hysterectomy.
Yeah, with the hysterectomy and the ovaries being removed, the hormone levels, diminish so rapidly. And I don't think women are prepared enough for that change. Often I've seen women encounter great deals of stress, as just brought out in adjusting to those things. And then not really provided the information about hormones. Many women are fearful of hormones because of
Mhm.
the studies and all the fear mongering around hormones. So
Mhm.
their doctors might suggest, oh, maybe you should go on hormones, very casually like that. And then they're fearful of that versus, really getting the education they need. Because if you are so young, those hormones are really essential. Your risk for cardiovascular disease, dementia, and bone disease all skyrocket if you're not adequately replacing or replenishing those hormones. So they're not informed and they're fearful. And so maybe they just don't take hormones and want to try to do things naturally, which is not going to work or be sufficient. So women are often just at a loss of who to trust or who are the experts, where can they get the information they need to help manage their life, after the fact.
For sure.
Yeah. Doc, how do you dose women for hormones who have premature ovarian insufficiency in their 30s? What kind of are you working for menopausal levels or reproductive levels, or how do you do that for women?
Mhm. So that's is somewhat dependent on the cause, I suppose. However, the levels you want to achieve for women in their 30s versus women in their 50s or postmenopausal are different. And you want to also, so they're higher, the levels, especially of estrogen. And you want to try in some way to cycle the patient so that they can have that natural cycling. It's very difficult, and some patients are just put on, hormones just here flat. Take these hormones, and that may work for the patient. It's I actually have a patient who I've worked with, and how would I say this? It's just very difficult to get the patient in a stable state, but definitely doable. It just takes working together, working on symptoms that the patient's having in addition to a lot of labs, but it's definitely possible and extremely important because as you said, if you do not maintain those levels, their bone health is affected and their cardiovascular health is at risk. And dementia risk is there. So very,
It's so heartbreaking to hear the stories of women and the difficulties they face. I like how you brought out the life-saving impacts of starting
Mhm.
HRT, and that was pretty consistent throughout the surveys that
Mhm.
women noticed huge changes and improvements with HRT. And I think it's not the same with menopausal women. It's a totally different experience, but menopausal women also experience these huge adjustments to their persons and their mood and their vaginal health and their sexual drives and energy levels and hot flashes. Sleep came out a lot in this study
It
that
did,
young
yes.
women they cannot think, they cannot work because they cannot sleep. And so the hormone replacement therapy can be so life-changing. I'm not a fan of like magic bullets or
Mhm.
trying to solve everything with medications, but it's absolutely essential for these women. So I'm glad that this study came out. I'm glad we got to review it together, and I hope more menopausal women also will get to experience the relief that comes from using hormone replacement therapy to so they don't have to have sleepless nights and, you know, be angry at their husbands and
For sure.
their social lives and all of these things. Anything else, Doc, that you would wanted to touch on?
Not today. I think that hormone the today from today the lesson is hormone replacement therapy is life-saving. And we have the opportunity with our knowledge to provide that every day. So that's a gift for us to be able to give to our patients.
One thing I just thought of from what you said, you know, the woman that you're working with, I think that is so valuable that that patient has someone that can walk along that journey with her, who knows her, who can
Mhm.
adjust her dose based on her season of life. And as that fluctuates, that relationship piece is a huge part of the medicine to have a provider that's willing to work with you. And so I just wanted to point out how valuable and important that is in this day of like fast medicine. And
Yes, definitely not fast medicine, and so I love it. I
mm,
love what I do.
yeah. Well, thanks so much for joining us, and I hope that you enjoyed this episode. Leave us a comment if you liked anything, and we look forward to meeting again soon. Thanks so much.
Thank you.